The government is back open, and we need to talk about what it means for pharmacy. We have an APhA member testifying on the Hill today in support of the ECAPS bill, a bill that promises to expand pharmacists' scope of work as well as improving their reimbursement policies. I'm excited to hear what they have to say, and I'm sure you are too. So be sure to click that like and subscribe button, leave a comment to join the conversation today, and let's dive in. Dr. Allison Reichert, welcome to RX Report. It's good to have you on the show. Welcome.
Thank you for having me.
So you just testified today in front of the U.S. House Ways and Means Health Subcommittee, and you're testifying on the empowering of pharmacists to provide care for common conditions, which kind of feels like something that should have been allowed ages ago. So why are you making this big push towards this goal now?
Yes. So first of all, I just want to say I'm so appreciative of APhA for leading the charge on this. And I see daily in my practice the gaps in care for my patients. The area I live in is extremely rural, and a lot of patients go without access to health care. And so I think in the last several years, we've seen a large exodus from healthcare. And unfortunately, our rural communities like mine have suffered greatly from that. It's not due to anything on the fault of their provider, rather just the lack of resources. And so ECAPS really helps to empower pharmacists to provide these services for our patients and practice at the top of our licensure.
You mentioned how there's a big healthcare exodus happening right now. Can I ask what personally inspired you to be a pharmacist? As I understand, pharmacy has actually been in your family for years, generations.
Yes. So I grew up in a family pharmacy. The year I graduated pharmacy school was the 100th anniversary year of our family's pharmacy. And so I think growing up in that environment is exactly what inspired me to become a pharmacist. Growing up, my dad is a pharmacist, and so growing up and seeing the relationship that he has and still has with our patients today really inspired me with that, important role he plays in the community that we live.
And I'm sure it's kind of not nepotism, but he's saying like, look, I'm a pharmacist. It's really awesome. You should continue that tradition. There's a little bit, is there any sort of pressure there?
Well, I don't think that there was necessarily pressure there. I think my parents always guided us. Myself, I have a younger brother, and they've always pushed us to do, what we wanted to do. But I think from an early age, I kind of latched on to that. And it was just kind of something that was in my blood, I think. That's always what I was going to be. I kind of was like that young kid that had, the boring answer. What do you want to be when you grow up? And it's like, oh, I want to work at the drugstore with my dad.
But that makes sense. You as a kid had every college kid's dream of. You knew exactly what you wanted to do way before the rest of us were trying to find ourselves. So, that seems like an asset to me. Today, you're specifically testifying in support of the ECAPS bill, which would allow pharmacists to be reimbursed via Medicare Part B and provide more services to different populations. So why should non-pharmacists on the House subcommittee really care about how pharmacists are getting paid?
Yeah, absolutely. So I think that patients everywhere are struggling to find the health care that they need. And so for these congressmen, I believe, no matter where they are from, I think that we can almost guarantee pharmacists play a significant role in providing the health care to their constituents.
Again, you mentioned that healthcare exodus happening right now. What would you say to young pharmacists that are just about to enter the field? What would you say to inspire them or get them ready to go?
So I think I'm a little bit biased in this question.
Maybe a little bit, yeah.
Yeah, maybe just a little bit. But I think that rural communities right now represent the largest area where we can make significant impacts in the health care that we provide to our patients and, really make an impact with the outcomes we provide for them.
So you mentioned in your testimony today how passing ECAPS would promote reduced hospital readmissions and improve chronic disease management. And I'm really questioning how it can be that effective. Can reimbursing pharmacists and expanding their scope of care really overhaul the American healthcare system that dramatically?
Yeah, so absolutely, I believe that's true. So when pharmacists are empowered to provide preventative care, we know that hospitalization rates and readmission rates go down. And so by empowering pharmacists to provide that care, eCare helps Medicare to spend smarter. It shifts the cost from emergency rooms to community-based settings like pharmacies, where it provides a greater access for patients who need it most in our rural communities.
So being a pharmacist is not a lazy job. You have long hours, you're on your feet a lot, you're working with a lot of different people who can be nice or maybe not so nice, but you are actively advocating for more to do, which to a lazier person like myself seems kind of questionable, maybe is a polite word to say it. So I really got to ask, why are you actively advocating for more work to do in your already very busy profession?
Sure. I don't think any pharmacist will argue with you that we're not busy. However, I think the answer to this is simple, and I think it's that we see the need. I see this need in my patients every day in my own community. And as a pharmacist, I know that I have the clinical skills and abilities to help fill in and bridge these care gaps in rural communities like my own. And so I feel like with that, we can really make a difference in the outcomes for our patients.
So can you tell me why it would be better for a pharmacist to provide some of these services rather than me going to a hospital? Again, you mentioned in your testimony how this would reduce hospital readmissions. I mean, why should I go to a pharmacist instead?
Sure, absolutely. So I think there's two things. There's cost and convenience. And I mentioned before that, and I mentioned in my testimony that ECAPS shifts the costs from emergency rooms to that community-based setting. And then it's the convenience factor, having access in our rural communities. In the community I live, the nearest emergency room or convenient care is 30 to 40 miles away, sometimes an hour, depending upon the patient's location. And so by being able to provide these services in community-based settings, I feel we can really reach a population of patients that may otherwise go without care.
You're obviously very passionate about being able to provide care, about expanding care, and you've seen these giant gaps in the rural space in particular. But again, this has been in your family for generations. What does it personally mean to you to be a part of a pharmacy family for over 100 years and now actively advocating for change in that profession? I mean, I imagine that's not just professional, that's very personal.
Yeah, I do believe so. So for me, it's a deeper connection. When I walk into my family's pharmacy, I have memories of my grandmother who worked there. I work alongside staff who helped raise me. And with 2 locations now, I've learned how a pharmacy family can be grown from new relationships. And so it's not just punching a clock for me. It's really part of my identity. Not many people are fortunate enough to be able to work alongside a parent, and I am. I get to do that every day with my dad. My dad has taught me so much about the business while continuing to push me to evolve our family's pharmacy legacy.
See, I mean, that's very unique, I feel, because if I was working with my parents, my dad would probably kick me out just for being too loud. I imagine that's not exactly something welcome. But, I mean, it's great that it makes you closer to your family. It brings you together in something that is desperately needed in just the American healthcare system right now. I've really got to ask one last thing before we sign off. Again, you testified on the Hill today. You made your case, and we've been arguing for pharmacists' ability to provide care and be paid for said care properly for what feels like eons now. If you could leave the government officials that you spoke today with one final message, can I ask, what would that be?
Yeah, so I think that no matter where you're from, patients everywhere are struggling to find the health care that they need. And we as pharmacists have the clinical knowledge and skills able to fill in those gaps. If you look at how the pharmacy profession has evolved over the last decade, we have proven time and time again that we can contribute meaningfully to healthcare teams. So from patient education to MTMs to healthcare screenings, vaccine deployment during a pandemic, pharmacists have risen to the occasion time and time again. We stand willing to do that again, and I ask that they give us that opportunity.
Dr. Allison Reichert, thank you for being on our X Report, and good luck to you. We loved having you here.
Thank you so much.
And that is our show. Thanks so much for listening, and thanks to Dr. Allison Reichert for joining today's show. I appreciate you listening, so be sure to leave a like and subscribe to let us know that you liked today's show. Maybe leave a comment and let us know what you thought about what we talked about today. Till next time, our executive producer is Rob Hodges. Our creative producer is Kate Erdman. Our editor is Michelle Powell. And until next time, coming to you from the home of pharmacy of the American Pharmacists Association in Washington, D.C., I've been your host, Mason Manuel. We're off next week, but we'll be back the following month to share some more pharmacy insights, so be sure to tune in then for our season finale. Till then, bye y'all.